When was the last time you actually looked at your feet? Not just a quick glance, but really looked. Have you noticed any unusual tingling or numbness in your toes lately? Have your feet been feeling cold even when the rest of your body feels warm? Have you seen any sores or cuts on your feet that seem to take forever to heal? Have you been dismissing these signs as just getting older? If you answered yes to even one of those questions, what you are about to hear could change everything. Most seniors in this country have no idea that their feet are sending out distress signals long before any doctor runs a blood test. The CDC estimates that over 37 million Americans are living with diabetes right now, and nearly 1 in 4 of them do not even know it. What is even more alarming is that by the time a formal diagnosis happens, the damage to your nerves, your circulation, and your tissues may have already been building for years. The signs were there the whole time. They were just on your feet. You may not imagine that a strange smell, a swollen toe, or a patch of dry skin could all share the same dangerous origin. But they can, and that is exactly what we are going to expose today. I will also share at the end one specific detail that most people, including many patients, never hear from their doctor, and it could make the difference between catching this early and losing that window entirely. That is why today you will see the 10 warning signs in your feet that could mean diabetes, ranked from concerning to absolutely critical. I am Dr. Kyle Hargrove, a general practitioner and family medicine physician based in Chicago, Illinois, and this information is something every American adult over 50 needs to hear right now. Before we get started, please tell us in the comments your name and the city you are watching from. We would love to know. Now, before we go through each sign, you need to understand why diabetes shows up in your feet first. Diabetes, especially type 2 diabetes, attacks two things above everything else: your nerves and your blood vessels. Your feet are the farthest point from your heart, which means they receive blood last and feel nerve damage first. When blood sugar stays elevated for months or years, it slowly poisons the small nerve fibers and narrows the tiny blood vessels that keep your feet alive. That is why so many different symptoms, from tingling to infections to color changes, all trace back to the same underlying crisis happening inside your body right now. Sign number 10, unusually dry and cracking skin on your feet. You probably think dry feet are just a cosmetic problem. You grab some lotion from CVS, rub it in before bed, and forget about it. But here is what your dermatologist and your primary care doctor may not have connected for you. Severely dry, cracking skin on the feet and heels is one of the earliest external signs that your autonomic nerves are being damaged by elevated blood sugar. The autonomic nervous system controls the sweat glands in your feet. When those nerves are disrupted, your feet stop producing the natural moisture they need. The result is skin that becomes thick, rough, and prone to deep cracks called fissures. These fissures are not just uncomfortable. They are open doors for bacteria and fungal infections to enter your body. And when circulation is already compromised because of diabetes, those infections do not heal the way they should. What starts as cracked heels can become a wound that refuses to close. This is not about using the wrong lotion. This is about nerve dysfunction happening beneath the surface. If your feet have been persistently dry, despite moisturizing regularly, and especially if you also drink a lot of soda, eat processed foods like packaged cereals and fast food regularly, or have a family history of type 2 diabetes, do not brush this off as a seasonal skin issue. Dry, cracking feet in a person over 50 with any of those risk factors deserves a fasting blood glucose test, not just another tube of lotion. The next sign is one that most people completely misread. They think it means they are sleeping in the wrong position, but it is far more serious than that. Sign number 9, tingling, burning, or numbness in the toes and feet. This is the classic sign that gets dismissed more than almost any other. You feel a strange buzzing or burning sensation in your toes. Maybe your feet go numb after sitting for a while. You figure you were just sitting with your legs crossed, or your shoes were too tight. You shake it off, literally, and move on. That is one of the most dangerous mistakes a person over 50 can make. What you are describing is peripheral neuropathy, and it is the most common complication of uncontrolled diabetes in the United States. The American Diabetes Association reports that over 50% of people with diabetes will develop some form of peripheral neuropathy. It happens because high blood sugar over time damages the myelin sheath that surrounds and protects your nerve fibers. Without that protection, nerves misfire, sending false signals of burning or tingling, or they go silent entirely, causing numbness. The burning sensation is often worse at night. Some people describe it as walking on hot sand or feeling electric shocks in their toes. Others lose feeling so completely that they cannot tell if water is hot or cold when they step into the shower. That loss of sensation is extremely dangerous because you can injure yourself without knowing it, and those injuries become infected without you ever feeling pain. If your feet tingle, burn, or go numb regularly, get your hemoglobin A1C tested this week. Not next month, this week. Sign number 8, slow healing wounds or sores on the feet. You nick your foot on the corner of the coffee table. Normally that would be nothing, a small cut, a few days to close up, done. But if that cut is still open 2 weeks later, or if it keeps reopening, that is not bad luck. That is a medical red flag. Diabetes impairs wound healing in multiple ways simultaneously. High blood sugar reduces the ability of white blood cells to fight infection. It thickens the blood, reducing circulation to the extremities. It damages the small blood vessels that carry oxygen and nutrients to healing tissue. The result is that wounds that should close in days instead linger for weeks or months, becoming chronic ulcers. The American Podiatric Medical Association reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. Approximately 85% of diabetes-related amputations are preceded by a foot ulcer. That number should stop you cold. A study published in the journal Diabetes Care found that patients with poor glycemic control were significantly more likely to develop chronic, non-healing wounds, and that early blood sugar management reduced ulcer recurrence by nearly 40%. If you have any sore on your foot that has not shown clear signs of healing within 10 days, do not wait for your next scheduled appointment. Go in now. Before we continue, if you are finding this information important, please subscribe to this channel and turn on the notification bell. Having constant access to science-based health information is what allows you to age with strength and awareness. It costs nothing, and it could save your life. Sign number 7, changes in the color of your feet or legs. Healthy feet have a fairly consistent skin tone, maybe a little variation, but nothing dramatic. When you start noticing that parts of your foot or lower leg look unusually red, or that they turn pale or even bluish when you elevate them, that is your circulation sending an emergency signal. In diabetic patients, small blood vessels become stiff and narrowed due to a process called atherosclerosis, which is accelerated dramatically by high blood sugar. When blood cannot flow properly, skin changes color. Redness that does not fade can indicate inflammation from an early infection. Pallor when the leg is raised, and redness when it is lowered, a phenomenon doctors call dependent rubor, is a classic sign of peripheral arterial disease, which is extremely common in people with type 2 diabetes. In some cases, parts of the foot can develop a purplish or dusky discoloration, which signals that the tissue is not getting enough oxygen. This is a pre-gangrene warning, and it is deadly serious. If someone tells you that your feet look a different color than usual, or if you notice it yourself, especially alongside any of the other signs in this list, that is a same-day call to your doctor, not tomorrow. Sign number 6, frequent foot infections, especially fungal ones. Have you been battling athlete's foot for months? Does it keep coming back no matter what spray or cream you use from Walmart or CVS? Does the skin between your toes stay raw and irritated? This is not just bad hygiene. High blood sugar creates an environment where fungi and bacteria thrive. Glucose is essentially food for microorganisms, and when your sweat, your skin, and even your blood carry excess sugar, your body becomes a breeding ground for infection. Fungal infections like athlete's foot, ringworm of the feet, and toenail fungus are dramatically more common in people with elevated blood sugar. The same is true for bacterial infections that cause redness, swelling, and warmth in the foot. A study published in the Journal of Clinical Endocrinology and Metabolism found that people with type 2 diabetes had a significantly higher rate of recurrent skin and soft tissue infections compared to non-diabetic individuals of the same age, and that poor glycemic control was the single strongest predictor of recurrence. If your foot infections keep coming back despite treatment, do not accept chronic infection as your new normal. Ask your doctor to check your blood sugar. You may be treating the symptom while the real cause goes unaddressed. Sign number 5. Thick, discolored, or brittle toenails. Most people assume that yellowing or thickening toenails are just an age thing, something you accept after 60 or 70. But nail changes in the feet can be a direct reflection of what is happening to your circulation and immune function. Diabetes compromises blood flow to the extremities, and the nails are the last stop on that delivery route. When the nail bed receives less oxygen and fewer nutrients, nails become brittle, slow-growing, and prone to infection. Fungal nail infections, called onychomycosis, are 2 to 3 times more common in diabetic patients than in the general population. These infections cause nails to become thick, yellow, brown, or even black, and they can separate from the nail bed. Left untreated in a diabetic patient, a nail infection can spread to the surrounding skin and deeper tissue, creating a wound pathway that is extremely difficult to close. Beyond fungal infections, very pale or white nails can indicate severe anemia or protein deficiency associated with metabolic dysfunction. Dark streaks under the nail, while sometimes harmless, can also indicate poor circulation or nail trauma that went unfelt due to neuropathy. Do not assume your nail changes are cosmetic. They may be the most visible sign of a deeper metabolic problem. Sign number 4, swelling in the feet and ankles. You have probably seen this one. Maybe you have experienced it yourself. Your feet and ankles puff up, especially toward the end of the day. Your shoes feel tight by evening. You press your finger into your ankle and it leaves an indentation. This is called pitting edema, and while it has several possible causes, including heart failure and kidney disease, it is extremely common in people with uncontrolled diabetes. Diabetes damages the small blood vessels, making them leaky. Fluid seeps out of the vessels and pools in the surrounding tissue, especially in the feet and ankles because of gravity. At the same time, diabetes is a major driver of kidney dysfunction, and when the kidneys fail to filter and regulate fluid properly, fluid retention gets dramatically worse. High sodium intake, common in an American diet full of fast food, canned soups, and processed snacks, makes the swelling even more severe. A study published in Diabetes and Vascular Disease Research found that lower extremity edema was present in a significant proportion of patients with newly diagnosed type 2 diabetes, and that many of these patients had no prior symptoms beyond the swelling itself. In other words, swollen feet may be the first and only symptom some people notice before diagnosis. If your feet swell regularly and you have other risk factors such as being overweight, eating a high-sodium diet, or having a family history of diabetes, do not assume this is just from standing too long. Sign number 3, a feeling of extreme cold in the feet, even indoors. This one catches people off guard because they expect diabetes symptoms to involve heat, burning, or pain. But cold feet, persistent cold feet that do not warm up even with socks and slippers on a warm day inside your home, are a serious warning sign of peripheral arterial disease caused by diabetic vascular damage. When blood vessels narrow due to years of high blood sugar exposure, less blood reaches the feet. Blood carries heat. Less blood means less warmth. Your feet become chronically cold because they are chronically underperfused. This is completely different from just having cold feet on a winter morning. This is a persistent daily coldness that never fully resolves, often worse in one foot than the other, sometimes accompanied by a leg cramp when walking, called claudication. The distinction matters because claudication, that cramping or aching in the calf or foot when you walk, is a hallmark sign of peripheral arterial disease, which dramatically increases your risk of heart attack and stroke. The American Heart Association notes that people with peripheral arterial disease are 4 to 5 times more likely to have a heart attack or stroke than those without it. Cold feet that never fully warm up, especially in someone with other metabolic risk factors, deserve a proper vascular evaluation, not just thicker socks. Sign number 2, red, shiny skin on the lower legs and feet. This one is subtle, and that is exactly why it is so dangerous. You might not even notice it unless someone else points it out, or you happen to see it in a mirror. The skin on your lower legs and feet takes on a stretched, shiny appearance, often with a reddish or reddish-brown tone. There may be little or no hair remaining on the lower legs and the tops of the feet. These changes happen because chronic high blood sugar damages the structure of the skin itself. The collagen fibers that give skin its normal texture and resilience become glycated, meaning sugar molecules bind to them and deform them. At the same time, the loss of hair on the lower legs is a direct sign of reduced blood circulation. Hair follicles require a consistent blood supply. When circulation is compromised, follicles die and hair stops growing, leaving the skin looking smooth and hairless in areas that should not be. Shiny, hairless lower legs in an adult over 50 is considered a clinical sign of peripheral arterial disease by many vascular specialists. Combined with the other signs on this list, this visual pattern creates a picture that your body has been painting for a long time. A study in the European Journal of Vascular and Endovascular Surgery confirmed that loss of leg hair and skin texture changes were independent markers associated with significant peripheral vascular insufficiency in patients with metabolic syndrome. Look at your lower legs right now. If the skin looks tight, shiny, and hairless below the knee, that image belongs in your doctor's office, not just in your memory. And now we arrive at sign number 1. This is the sign that most people never connect to diabetes. It is the one that sits quietly, gets misattributed to everything else, and yet in clinical practice, it is one of the most reliable early indicators we have. Pay close attention. Sign number 1. Changes in the shape of the foot, especially a collapsing arch or unexplained deformity. You have been living in your body for 60, 70, maybe 80 years. You know what your feet look like. But what if one morning you notice that the arch of one foot looks different? That one foot looks wider or flatter than it used to? That a toe has started bending in an unusual direction without any injury to explain it? Most people chalk this up to aging, maybe arthritis, maybe just flat feet getting worse. And sometimes that is true. But there is a condition called Charcot foot, or Charcot neuroarthropathy, that is almost exclusively seen in people with diabetic peripheral neuropathy, and it is one of the most underdiagnosed catastrophic complications of diabetes in the United States. Here is what happens. When the nerves in your feet are severely damaged by years of high blood sugar, you lose the protective pain signals that tell you when a joint is under stress. Without that feedback, you keep walking on joints and bones that are quietly fracturing and disintegrating. The bones in the foot collapse. The arch falls. The foot takes on a rocker bottom shape that is unmistakable once you know what you are looking at. The tragedy is that because the patient feels no pain, they assume nothing serious is happening. By the time the foot looks visibly deformed, significant structural destruction has already occurred. Charcot foot can lead to permanent disability, chronic ulceration, and amputation if not caught and treated urgently. But here is the part that makes this even more alarming. Early Charcot foot, before visible deformity, presents as warmth, redness, and mild swelling in one foot that looks and feels like a sprain. It is routinely dismissed as a twisted ankle. Patients are sent home with ice packs and told to rest. Meanwhile, the bones are collapsing. The CDC notes that diabetic foot complications account for more hospital days than any other complication of diabetes. Charcot foot is a major driver of that statistic. If you have been told you have nerve damage in your feet, if one foot is suddenly warmer, redder, or more swollen than the other without any injury you can remember, treat that as a medical emergency, not a sprain, an emergency. And now, as I promised at the beginning of this video, here is the detail that most people never hear. The single most actionable thing you can do right now is this. Take off your shoes and socks every single night and inspect the bottoms of your feet with a hand mirror before you go to sleep. Not because you are looking for something dramatic, but because people with early diabetic nerve damage lose the ability to feel small injuries, and those injuries become infections overnight. Research published in Diabetes Care showed that patients who performed daily foot self-examinations had a 60% lower rate of progressing to foot ulcer compared to those who did not. 60%. You do not need a prescription for this. You do not need Medicare approval. You need a mirror and 1 minute of your evening. That single habit, done consistently, has saved more feet and lives than most people realize. Start tonight. Your feet are not just the foundation of your body. They are the window into your metabolic health. Every single sign on this list, from cracked skin to a collapsing arch, traces back to the same process. Years of elevated blood sugar slowly destroying the nerves and vessels that keep your body alive from the ground up. Most people wait for a diagnosis to start paying attention, but the diagnosis is not the beginning of the story. It is just the moment the story became impossible to ignore. Your feet have been telling it all along. The question is whether you are going to listen now or wait until the damage writes its own ending.